So next we're going to hear from Anna Fangmeier from Vanderbilt University. She is a Master of Genetics Counseling student there. And she's going to talk to us about the SGS disease concept study. And that's going to help us learn a lot more about the research that's being done for SGS and for our kids and for our angels and for our families. Anna grew up in the United States. She grew up in Nebraska, and she graduated from the University of Nebraska-Lincoln in 2014. She pursued an interest in neuroscience, so that tells you that she's very smart. And as an undergraduate research assistant in developmental brain laboratory. And she was in a neuropsychology labradory that used this is a big word for me. I teach 5th grade, I teach 10-year-olds. So electroencephalography. Oh, Anna, I know I messed that up for you, so you can fix that, to study brainwave data. So she worked as an analyst in a pharmaceutical research while working towards her bachelor's of science degree in biology. But she now works as a genetic counselor assistant, and she's studying for her Master of Genetic Counseling as a student at Vanderbilt University in Tennessee. So Anna, thank you for coming, and we're excited to get to hear from you.
Well, thank you so much, Charla. Thank you for the kind introduction. Yes, that electroencephalography is such a long word. I usually just shorten it to EEG. But thank you so much. And thank you to the SGS Foundation for allowing me to speak a little bit about the research that I'm working on for my thesis as part of my master's program. So I'll go ahead and share my screen. Okay. So my thesis, really the title is, creating a disease concept model for Schinzel-Giedion syndrome and for SETBP1 haploinsufficiency disorder. I'm looking to interview families and caregivers and look at kind of like the whole spectrum of the SETBP1 gene. So really, a lot of my talk is going to focus on like, what is a disease concept model? It is something I didn't hear about until I came to Vanderbilt, and the individuals at Combined Brain came to talk to us and tell us about like what disease concept model is and like the benefit it can have in research and to patients. So a disease concept model, it's really a relationship, model describing the relationship between patient symptoms and characteristics and the disease impact on daily life. So in the past, we would look at impact, disease impact by reviewing scientific literature and then interviewing clinical experts. However, that kind of leaves out input from patients themselves, families, and caregivers. So the disease concept model here includes interviews with caregivers as well as healthcare providers and educators to identify the different characteristic domains, the patient impact, and then the caregiver impacts. So why is this important, or why am I even interested in this in the first place? So a disease concept model can help identify and prioritize symptoms and disease impacts for future clinical research. So kind of the study endpoints in clinical trials that we might be looking at can help guide and identify those. And it can also be a precursor to identifying clinical outcome assessments. It can be helpful in smaller patient populations to guide or be some sort of reference in medical management. And then as symptoms and disease impacts change over time, disease concept models can be reviewed and updated as needed. So next question is, how am I going to form a disease concept model? How are we going to do this? So it does start out with reviewing the current scientific literature. And based on that, we have a preliminary disease concept model that we create. And that is what we use to then help guide some of the interviews we'd be doing next. So the interviews we do are what we call semi-structured concept elicitation interviews. It's a big, long, fancy word for basically just what we call qualitative interviews. They're very open-ended. The goal of these interviews is not for me to do the talking, but for the individual I'm interviewing to do the talking. I want to hear their story and what they have to say. So these interviews, like I said, are going to include caregivers. Providers would include physicians, genetic counselors, and therapists, and then also educators. And so these open-ended interview questions are going to be something along the lines of like, walk me through your morning routine. Or something like, what does a good day look like to you? What does a bad day look like for you? And I have a few other questions I might ask to make sure that I am hitting, covering the different impacts, disease impacts and symptoms that we're hoping to cover. But really, again, I want families and caregivers and the interviewee to be driving our discussion. And then these interviews will be recorded. And I will be, feeding it into a transcript service. And basically through the interview transcripts, I will identify themes. And that's what comes into creating this concept model. So I think an example is always incredibly helpful, especially when talking about something like a disease concept model. So this is pulled from a paper called A Conceptual Model for Angelman Syndrome. And then they also reviewed the clinical outcome assessments. The one part that's not shown in this picture here is they did also identify the Angelman syndrome like characteristics and symptoms. I think that's something we're a little bit more familiar with, but the thing that really gets me excited about disease concept models are these domains that basically identify patient and caregiver impacts. So you can see that it's not just looking at just symptoms. We want to know, like, how is your life impacted? How is your child's life impacted? And that way research can be more influenced by caregivers and families, like driving how research moves forward. So really then this comes to my research question. And again, it's basically in the title. It is to develop a disease concept model for both Schinzel-Giedion syndrome and SETBP1 haploinsufficiency disorder. And that's through interviewing and caregivers, providers, and educators. So again, specific aims, kind of like my main goals. It's, again, to interview and determine those patient symptom impacts and caregiver symptom impacts of Schinzel-Giedion syndrome, develop the disease concept model, also do this for SETBP1 haploinsufficiency disorder, and develop a disease concept model for SETBP1 haploinsufficiency disorder. Although I'm looking at the full spectrum of the gene, the goal is to have two disease concept models. They are two different conditions. So one will be for Schinzel-Giedion syndrome and the other will be for SETBP1 haploinsufficiency disorder. And then significance, kind of getting back to, again, why is this important? Again, disease concept models are a precursor to identifying the clinical outcome assessment. So this model is the hope and the goal is this can be used for future clinical research, for clinical researchers to take this and use it as a guide. In rare diseases, sometimes we can have limited information available depending on the resources healthcare providers might have. And so this can be used as a possible resource for medical management, especially in characterizing the condition. And then, I think a part of this will also be developing kind of a spectrum for SETBP1 related disorders. We have these two conditions, but we also have kiddos that don't quite fall strictly into one or the other and can fall in between. And so I'm really hoping the study, we can interview those individuals as well and get kind of that whole spectrum. And then also really having patients, caregivers, and families share their stories. Again, this disease concept model, what I'm so excited about it is I get to hear the stories from families and caregivers. And then before I get to questions, you know, this is the flyer that we have. We have had the IRB go through, which is very exciting. And so this is the flyer we have, just saying the information and like what the study is about. I know there's quite a few words on this, but I'll provide this for the SGS Foundation. They have access to this as well. But yeah, as far as recruitment goes, we're looking for individuals willing to do a 60 to 90 minute audio recorded interview. And this is, like I said, going to be those open-ended interview questions about how SGS has impacted you, your child, and your family. And from there, we'll use that in order to create the disease concept model. As far as those that qualify, we are primarily looking to interview caregivers, and so caregivers that are 18 years or older with a child diagnosed with SGS. And then that's kind of what I had prepared. So thank you so much for letting me speak a little bit about my research here today. But I would love to answer any questions that anyone has.
Anna, it looks like there's a question in the chat.
Yeah.
And it says, in what format will the disease concept study be available at the end of the study? Will it be like a medical paper, a leaflet, or a website?
That's a really good question. It'll be a medical paper. I intend to publish this research, and so yeah, it'll be published as a part of the scientific literature.
Well, I'm thankful for that. When I Googled in 2013, I know that we talked about this yesterday, like it was medical journals that did not make sense. It's just medical jargon. And like having like a, hey, this is what a morning looked like would be so beneficial to families going, I don't care about the medical aspect. I need to know what to do with my kid today or tomorrow. So that's awesome. Is there any other questions that anybody would like to ask? Okay, here's one. Will you just interview the parents? Or what are you, I guess, are you doing caregivers, the therapists, siblings? Who are you planning on interviewing?
Yeah, so we're kind of qualifying it as caregivers. Here, I can probably also stop sharing my screen to see everybody a little bit better. Yeah, so primarily what I'm asking for here is interviewing caregivers, and that's just really family members, whoever is considered like a primary caregiver for the affected individual. And I know a lot of times that can be parents. We'll also be interviewing healthcare providers, so physicians like Dr. Dewis, genetic counselors that have expertise in SGS, and then also like physical and occupational therapists that have worked with individuals with SGS. And then, yeah, educators is something we're adding into this one that hasn't been added into previous disease concept models. So any teachers and other educators that have worked with kiddos with SGS. I think there's definitely room in the future for disease concept models to also include like siblings and more members of the family. But this is a good starting point.
So would your disease concept study then tie in with the kind of standard of treatment that Dr. Dewis is talking about? So will you be able to share information across the two studies? Because if parents are sitting down and talking to you and saying, right, my child has constipation, this is what we do, this is how we treat it, that's great information to be able for us as a foundation and Dr. Dewis to be able to put together a good standard of care for probably almost all aspects of SGS that we're in, that parents are experiencing or caregivers.
Yeah, the goal would be like with the publication of it, this would be accessible to other providers, and yeah, then be able to influence, because I know when families first receive the diagnosis, you're asking what should I expect? What is this going to look like? And hopefully the disease concept model can help providers, especially ones with, Dr. Dewis is an expert, but, not all providers are familiar with SGS. Give them a resource to, have an idea of what have other families experienced and what can we have kind of on our radar. So yeah, Dr. Dewis would absolutely have access to it. If that helps in their medical management of individuals diagnosed with SGS, that'd be fabulous.
Thank you.
There's another question in the chat. Are you wanting both parents of classic and atypical SGS in the study?
Yeah, another good question. I would want both parents of classical and atypical. If we're trying to get a full idea of how individuals are impacted by SGS, I think that includes getting, that full spectrum like we were talking about.
So Anna, would that mean different ages, male, female, newly diagnosed versus a child who's been diagnosed for, a number of years, just as you say, to get that kind of full picture of I suppose, what the journey the families go through as well?
Yeah, I would definitely say so. We know that there are different impacts in different stages after the diagnosis, and different impacts happen early on in the diagnosis, but there are different things that come down along the line as well. So yes, I really would like to get a full, full spectrum. And I know that can sometimes be a big ask, but as thorough as we can make it I'd be thrilled to have that.
I'm sure we can find willing families because this is going to help their children. And I think to put all of these things we've talked about into context, because it's really exciting to talk about the disease concept study. Obviously, we have the ORCA study, and we're talking about developing standards of care to guide medical professionals through how to treat a child with SGS at different stages of their life. I think with the disease concept study, that will allow experts like Dr. Dewis almost to do a double check and make sure, have we got absolutely everything in our standards of care guideline? Are we thinking about every single symptom that's important to families and making sure we've got a guideline around that for medical providers? Because I know that Dr. Dewis is planning to put together a panel of experts in neurology, oncology, so brain cancer, gut, think of some other issues our children get, orthopedics, urinary, and put a big panel of people together to actually discuss how is it best that we advise that these things are managed for our children. And then that will also be published. So then we'll have the disease concept study, we'll have standards of care guidelines, and suddenly our families are going to be able to download these really great resources that just haven't been available up until now. So I think it's, the next 12 months is a really exciting time for the foundation, because there's so much being done that's actually meaningful for families, that really gives them, resources to use to make sure their kids are getting the very best care.
And I have a quick question. So for families that are interested in participating, when are you planning to start the interviews, and what can they expect? Is this a phone call? Is this a Zoom meeting?
Yeah, thanks, Dana. Yes, so I'm planning to be conducting interviews throughout the fall, hopefully starting in September. In just a couple weeks is the goal. As the IRB is through, we can really start getting those scheduled. It'll be through a Zoom call, if not exactly Zoom, still deciding on the exact platform, but it'll be another, platform like Zoom. And that'll be like a 60 to 90-minute interview, really just, there's no strict time on it. It's really just when we feel like we've covered the topics, you feel like you've shared your experiences to the full extent. So yeah, that'll be set up via, a virtual Zoom or Zoom-like platform call.
Okay. And if folks aren't comfortable doing the face-to-face, can we have our cameras off, things like that?
Yes, I wouldn't require someone to have their camera on. Really, the importance is the conversation. it'll still need to be done through like Zoom or like a platform like Zoom, simply because that's in my protocol, and that's kind of how I'm able to be the transcript into how I analyze and identify themes later, but wouldn't require you to have your video on.
Okay, great. Thank you.
Yeah.
And I just wanted to mention that I'm going to be working with Anna to do these,
Yes.
partnering with her. So I'm very excited to meet some of the families and hear your stories.
So another question that is big for our foundation and our group is that people need to know if they can does their child have to be living to be a part of this study? Because you have a lot of families whose children have passed. And so I want to make sure that we're clear on that with those.
Yeah, that is something that Nuala brought up early in our conversations. And no, your child does not have to be living in order to participate in the study. Again, I think that is another step in kind of the overall looking at from diagnosis and the different stages after diagnosis. And your story is just as important as everyone else's. So.
Anyone have any other questions? I'm really thankful to Anna for actually telling me what an EEG was. My daughter Avery had EEGs all the time, and I never once thought to be like, what does that stand for? So now I know. Now I know.
Yes.
Super. And thank you, Anna, also for, I think, for devoting your thesis to SETBP1 gene and SGS being part of that. We really do appreciate that, because it's people like you that, you know, kind of shine a light on these very rare conditions that really helps us to do what the foundation is here to do, which is to help raise awareness and increase understanding of the conditions so that we can make sure our children do receive the best care. So a huge thank you from us for your time and for giving us this opportunity to work with you.
Oh, thank you so much. It's my privilege to work with you as well. Yeah, thank you.
So the first talk that we had today was from Dr. Jessica Dewis, and this was split into two. And the first part was about the genetics of Schinzel-Giedion syndrome, which is quite complicated, but essentially she explained very clearly to us that the gene that is mutated that results in the syndrome called Schinzel-Giedion syndrome is the SETBP1 gene, and this is on chromosome 18. And she explained that the mutations that happen on this gene are spontaneous or de novo, they are not inherited. And she also explained that when the gene is mutated, it causes, or the result of the gene mutation, the specific mutations that cause Schinzel-Giedion syndrome, it results in too much of that SETBP1 protein accumulating in the child's cells. And because the SETBP1 gene, and the gene forms the protein, because that's such an important gene that regulates so many other genes in the body, so it's like a master regulator gene, it has a huge impact not just on the brain but on so many other body systems. And that's why Schinzel-Giedion syndrome is so multisystemic. We know that because our children have brain problems and gut problems and kidney problems and vision problems, and you know, some of our children will get cancer as well. So it is a hugely multisystemic problem, and it seems to be because the protein is building up in the cell and causing a toxicity in the cells. And we're still trying to understand exactly what the impact of that is, but there is lots of research ongoing. She also made the interesting distinction, because I know that this has been a source of confusion for some of our families, the distinction between SETBP1 haploinsufficiency disorder and Schinzel-Giedion syndrome. And both of these conditions are caused by mutations on the same gene, the SETBP1 gene, but our children have mutations that mean that our kids have too much protein, and the children that have SETBP1 HD or haploinsufficiency disorder have mutations that mean that not enough protein is developed. So we've sort of got a seesaw with our children having too much protein and the CEP-BP1 haploinsufficiency kids having not enough protein, and it causes different syndromes, and the children with not enough protein are less affected than our children. It doesn't seem to be as multi-systemic. They have sort of a milder intellectual disability. And then Dr. Dewis gave a really interesting sort of more clinical talk about symptoms of Schinzel-Giedion syndrome, really highlighted the point this is multi-systemic, and it was really encouraging to hear her talk about the importance of advocating for your child to have screening. And we know this as families in our Facebook group. You know, we hear about children who have had these sacral tumors found incidentally, and we need to be screening for these earlier. There's a lot more preventative or proactive screening that needs to take place, and she's working, Dr. Dewis is working very hard to make recommendations and get publications into the literature to give guidance to doctors. She talked about the difference between a patient registry and a natural history study, and tomorrow we will hear about our patient registry, the Schinzel-Giedion syndrome patient registry, and that essentially is a platform where parents enter information about their children. And the natural history study, we could use the same, or we're planning to use the same platform, it's called Matrix, but the natural history study is when the doctor enters information about the child, and that may happen maybe every 6 months or maybe every year. So you're tracking that child over time and developing a kind of a natural history, or an idea of naturally how that disease is progressing over time. So they're both parts, as Dana pointed out, they're sort of essentially, they complement each other. And she talked about how her goal or her aim is to develop a multidisciplinary kind of center of expertise. But we know that, you know, Children's Hospital in Colorado won't serve all of our patients around the world. We're really international. So we need to look at ways of maybe using telehealth, and having other resources, like she has an email that she's looking to set up where doctors in different countries around the world can contact her via this email to get information about how best to treat their patients. And Dr. Dewis can arrange translators in, I think she said, over 400 languages. So that was quite impressive. So hopefully most countries, most languages will be served by that. And as a foundation, we'll kind of make that announcement shortly after this family meeting, so everyone's aware of that. So I'll hand over to Charla now to do the recap of the disease concept talk.
I'm so excited about that email too, because I know that I had doctors ask me like, hey, has there ever been anything that's been talked about in your Facebook group, you know, about SGS? So having an expert will be awesome. So Anna talked to us about the disease concept study, and this is really exciting, and I hope that a lot of our families are excited about getting involved in this, so that it'll help us look for themes among our SGS kiddos, which will then help us with medical management and the day-to-day things, so that we can answer those questions that we often have, and about our kids, and about how to best help them. And this study will be a Zoom phone call with or without camera, which we just found out. And you will get to share your story, which there's nothing better than talking about our amazing kiddos. So we are so thankful that someone has taken our small little group and is passionate about us and our kids, and helping us get some more research and awareness out there. So I think we went through some questions. So with time, what we'll do is we will go ahead and just tell you what's in store for tomorrow morning, for our last day of our first family conference. So tomorrow we will be looking at the SGS patient registry, which will help develop new life-changing treatments. And Dr. Terry Jo Fischel will be here with us to help us with that. And we will do a walkthrough so that you don't have to watch those videos of me walking through it that we put out on the website and on Facebook for you. And then we're going to go ahead and talk about what's next for the foundation and tell you all the exciting things that are coming up in the next year. One of which is starting in September with the disease concept study. So we hope to see you tomorrow, and thanks for coming.